Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I begin my update, I want to address some questions and concerns I have heard about the outbreak in the Kidana Meheret Ethiopian Orthodox Tewahedo Church in Calgary. First of all, I want to express my gratitude and appreciation to church leaders and members who proactively went for testing and who are working with Alberta Health Services to understand this outbreak. Second, I want to clarify that the recommendations I talked about on Monday apply only to those who attended the church from August 9th to 23rd. That is, I recommend that anyone who was at the church on those dates go for testing, that children who attended the church should temporarily stay home from school while information about the outbreak is being gathered so we can better understand who is at risk. Anyone who did not attend between August 9th and 23rd, even if they are a church member, is under no additional restrictions. I cannot emphasize enough that supporting those involved in outbreaks is critical to our collective success. I have heard that this community is now being targeted and stigmatized because of this outbreak, and I will say again that when that happens, we are all put at risk. Stigmatizing those with this illness only increases the possibility that fear of this negative attention will keep people from being tested and will drive the virus underground. We cannot fight COVID in the dark, and no region or group in society is immune from this virus. We are all best served by offering support and compassion to those who are dealing with outbreaks or isolated cases. Turning to today's update, we identified 130 new cases of COVID-19 yesterday, and the provincial lab completed 9,500 new tests. I'm pleased to announce that there were no new deaths identified in the province. Alberta currently has 1,415 active cases. 46 people are in the hospital, including 9 in intensive care. Today, I want to talk about a few changes we are making to our guidance and orders. First, we are making a minor change to our guidance for casinos and racing entertainment centres to allow table games. They can occur, provided physical distancing measures, barriers, and other health measures are in place, as outlined in the guidance online. Second, I want to talk about an updated framework for continuing care facilities that will be coming into effect in 2 weeks. Earlier this morning, I signed a new order to update our approach in these settings. As a part of the commitment I made to Albertans on Monday, I'd like to explain what this order means. Throughout this pandemic, we have closely monitored Alberta's continuing care facilities. These residents are most at risk of severe outcomes from COVID-19. As I've said before, the strict restrictions implemented this spring helped limit the spread of the virus, but took a toll on other aspects of residents' health. We must always balance the need to protect people from COVID-19 with the need to support the overall health and well-being of those who are being protected. These residents need joy, hope, and connection, just like the rest of us. Since updating our approach to visitors in July, we have continued to closely monitor continuing care facilities. While there have been a limited number of outbreaks, we have not seen a trend in these being caused by visitors. Rather, it seems that when community transmission levels are high, the risk of staff being exposed outside of work also rises. Most of our outbreaks in these facilities have been limited to 1 or 2 cases with no onward spread, thanks to the hard work of staff and management in these locations with the support of Alberta Health Services. We have heard from residents, operators, and families who are seeking greater adaptability in applying our current restrictions when risks are low. The updated order signed today will help address their concerns. It will allow operators of continuing care facilities more flexibility in adapting restrictions to balance the needs of their residents. Operators can now shift to a risk-based approach when residents return after being away from the site. In our previous approach, when residents left the facility, We used a measure of time spent off the site to determine when a resident needed to be in quarantine when they returned. This meant that any resident who was off-site overnight for any reason needed to be in quarantine for 14 days when they returned, and there were no restrictions on those who left for shorter periods of time. We heard clearly that this did not serve residents well. There are times when someone can leave the site for a weekend in a very low-risk way, and times when a resident may choose to attend an event for only part of a day, such as a family wedding, that may put them at higher risk of exposure. Because of this, we are adjusting the requirements for quarantine on return to the facility to apply to high-risk outings, independent of the length of time the resident is away. Medium and low-risk outings will have less stringent precautions applied, such as continuous masking of residents once they have returned, or enhanced symptom monitoring. Facilities can also choose to permit volunteers back on site, while providing volunteers with guidance for maintaining safety. We have heard of staffing challenges with some of the requirements like regular screening of staff and visitors, and this could be addressed with volunteers helping to achieve this requirement. So we are making adjustments to help operators with additional tools, like the ability to use volunteers to support the safety and well-being of residents. We are increasing flexibility when risk is low, but not reducing the overall protections in place. Other measures, including staff and visitor symptom and known exposure screening, and restrictions on staff working at more than one facility, continue to remain in place. I encourage residents and loved ones to be patient and give operators time to implement this order. While the order was signed this morning, it does not come into effect for 2 weeks, giving operators time to make the necessary adjustments. I would like to thank the operators and staff of our continuing care facilities for remaining vigilant and for keeping the safety of their employees and residents a top priority. I also want to thank those who are working hard this week as students return to classrooms. I know that many Albertans continue to have questions about schools. As students return to the classroom this week, including my own, who start tomorrow, as a parent, I know that we are feeling a mix of emotions. Some parents are relieved that their children will get to see their friends and teachers in person again. Some parents are relieved that they have kept their children home for remote learning. At the same time, we are worried about their health and well-being and have anxiety over the uncertainty of our new normal. We are, after all, the first parents in several generations whose children are going to school during such a serious global pandemic. Sending them back to school means putting our trust in each other, in the public health officials who are working with school authorities to help keep everyone safe, in the teachers and school staff who are leading the classrooms, and in our fellow parents who are screening their children for symptoms each morning. It also includes trusting our children to remember to follow new rules to help prevent the spread of COVID-19. We must also trust ourselves as parents that we have made the right choices for our own situations and that we continue to make the right choices to protect their school and our community. One of the most important things we can do as parents is to complete the health assessment with our children each day. I know this is not an easy task, particularly in arranging childcare when parents need to work. But today I want to highlight the importance of keeping children home if they are unwell and staying home if you are sick too. Wearing masks and keeping our distance reduces our risks of spreading the virus, but they cannot eliminate all risk of exposure. It may sound oversimplistic, but keeping sick children home from school will be critical to limiting exposure in schools and keeping schools open under Scenario 1. It will be equally critical in keeping our workplaces safe and limiting community transmission in the weeks and months ahead. I know that this will be challenging. Having a sick child at home is more complicated than it was before the pandemic. Now we will have to plan which parent will provide comfort so the other parent can support other children and household members. And in households with only one parent, this becomes very challenging. We will also need to think about practical steps, such as how to limit contact between a sick child and other members at home, and how to keep the family functioning while waiting for the symptoms to end and test results to come back. The same goes for parents, too. If we are feeling unwell this fall and winter, we need to stay home, arrange to be tested, and continue to isolate until our symptoms are gone. We all need to reject the mindset that working while sick is a sign of toughness, or that working through a cough or fever shows dedication to our jobs. Staying home when sick is a good thing. It shows we care about the health of our family and about the health of those around us. I know that this will be difficult for many parents, and that for some, staying home may create difficult financial, personal, and other stresses. I also know we are all longing to get back to how things used to be, but COVID-19 is not going anywhere. We all have no choice but to work together and support each other in the days ahead. Staying home when sick is crucial to our success during the coming months. This is not the time to let our guard down. We are all in this together, and by continuing to work together, we will get through this. Thank you, and I'd be happy to answer any questions you may have.
All right, we'll go to the phone now. In addition to Dr. Hinshaw, we also have Andre Corbould, Deputy Minister of Alberta Education, here to answer questions if needed. Operator, could you put through the first question, please?
First is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. Why do you think we're once again seeing outbreaks at meatpacking facilities in the Calgary zone?
It is interesting. Some of the facilities that are currently experiencing outbreaks did have outbreaks a few months ago and contained the spread quite quickly. So we're looking closely to see what the factors are this time that's causing more transmission in places where they were previously successfully contained. And again, the factors that seem to be coming to the surface are fear of losing income when sick. And so I think we all collectively need to think about whether employers or whether we're able to advocate for appropriate approaches to the CERB benefit so that people can stay home when they're sick and not be disadvantaged financially for doing that. And that does seem to be one of the driving factors at this time.
Operator, can you put through the next question, please?
This is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. How did the decision to reopen table games come about? You said in June that they weren't allowed to start up again, even though casinos in general reopened, because table games have more interaction and more potential chance of transmission. So what changed? And also just curious, when the pandemic first started, children stopped going to classes and many people shifted to working from home. Now that children are going back to school, should people still keep working from home? What's the best strategy moving forward to prevent a spike in cases and to try and flatten the curve?
With respect to table games, there are many pieces of information and analysis that went into that decision. The last few months, there's been an opportunity to assess whether or not there's been transmission in casino environments here, and also to look at other jurisdictions where casinos have opened with table games as a part of their process. We haven't seen transmission issues locally, and with casinos that have opened table games, we have not seen significant transmission events there. And so looking at the evidence of spread, as well as looking at the impacts and other factors that go into that decision, that's kind of that comprehensive look that went into deciding that particular piece. With respect to working from home, it really is a decision that employers and employees need to be making together. It depends on the context of the job, whether the employer is able to keep employees continuing to work from home. Some employers may choose to have employees come back, and others may choose to have them remain at home. And so again, that's something that really has to be worked out to be the right decision both for the employer and the organization, as well as what's right for the employee.
All right. Operator, could you put through the next question, please?
This is Lauren Krugel with the Canadian Press. Go ahead, Lauren.
Good afternoon. We're hearing about an outbreak at the drop-in center in Calgary. First off, I'm wondering if you had an updated number of cases for that, as well as whether this could have been avoided had there not been the exemption from the 2-meter distancing. And what is being done to ensure there's enough surge capacity and the staff available for the homeless individuals to isolate if they need to?
There is an outbreak at the drop-in centre in Calgary with 5 cases at this time, and Alberta Health Services is working with the shelter to ensure that cases are isolated, that close contacts are also kept away from others in quarantine, and that ongoing monitoring is taking place. At this time, I haven't been told that the sleeping arrangements were a contributing factor to the outbreak, so that's something that I would look to my colleagues in Alberta Health Services to help me understand. But the information that I've received at this point indicates that there is some evidence that transmission occurred between individuals when they were outside of the building. It seems that the patterns that they're seeing would indicate that it wasn't necessarily transmission within the building. But again, I'll be interested to hear the assessment of my local colleagues. With respect to shelter surge capacity, that would be a question that Community and Social Services would be best positioned to answer, as that is the file that they manage.
Thank you. Operator, could you put through the next one, please?
Next is Shannon Scott with CBC. Go ahead, Shannon.
Oh, hi, Dr. Hinshaw. I just had a question about the change that you announced today to the long-term care facilities. You talked about medium and low-risk activities and high-risk activities. I'm wondering if you can give us some examples.
Sure. So some of the examples that we were provided by colleagues who work with these facilities locally were, so for example, residents, and I think it's important to remember that continuing care is quite a broad spectrum, and so some of the residents who live in continuing care are actually quite independent, may have their own vehicles still, and are living in say, a lodge setting or another type setting. And so we had some examples of where an individual perhaps had a family cabin that they wanted to go away for the weekend to a family cabin by themselves, and yet the previous rules would have said, well, you've left overnight, and so when you come back, you need to be in quarantine for 14 days, even though that individual wasn't really in contact with anyone else, and there was no additional risk of transmission. Or we've heard, conversely, concerns about residents where they perhaps were leaving the facility, again, to participate either in a family gathering where they were seeing lots of people potentially. Again, because it's very difficult if you're seeing family after a long time being away, that they might have been in closer contact with family members and people who might have come from different parts of the province. So that potentially would put them at higher risk of exposure, even if they were only gone for an afternoon, as opposed to someone who was gone overnight but really wasn't in contact with anyone. So we're putting forward a framework that now looks at the risk of the outing and puts in place measures that are appropriate to the risk, rather than simply looking at a time frame.
Operator, can you put through the next caller, please?
Next is Kelly Kreiderman with the Globe and Mail. Go ahead, Kelly.
Hi there, Mr. Kerwold. I'm just wondering if you're hearing any concern from school boards or teachers about an unintended consequence of students moving to the hub model, and that being teachers having to teach there, schools having to allocate resources there, and the number of teachers teaching in school being reduced, leading to bigger class sizes right now as school starts up in Edmonton and Calgary.
Yes, so thanks for the question. We have heard some of those concerns, and in fact the Minister met with several education partners, and that was one of the points that we all work together and to collaborate on. And we are focused on solving those issues where they arise. School boards know where those issues are arising, and with the additional funding that we announced this week, we think that'll go a long way to address some of those issues.
All right, thank you, Kelly. Operator, could you put through the next question, please?
Next is Dylan Short with the Edmonton Journal. Go ahead, Dylan.
Hi, Dr. Hinshaw. In regards to these low, medium, and high-risk outings, is it the operator that determines what's the low, medium, and high-risk outing, or would that be Alberta Health or other officials?
In the guidance that's online today that accompanies the order, there is definition provided of what would fall into a low-risk category and what would fall into a high-risk category. With respect to medium risk, because there are several many actually complex interactions, it is left to the judgment of the operator in conversation with the resident to determine the risk level of the outing. And so it's felt to be fairly clear what would be a low risk outing, fairly clear what would be high risk, and so medium would be those outings that fall somewhere in the middle. And again, the expectation, as was with our visitor guidance, is that operators are talking with their residents, talking with family members to understand how the community of people who live together in that facility, and again, the family members who support them, what their risk tolerance is. And so we've heard positive feedback from the visitor guidance that it has enabled some of those conversations so people can discuss how to move forward together as a community. And so again, we provided them with those examples in that framework so that they can best determine how to assess the risk, and then working with those individuals and the community to understand how they want to manage that risk then when people come back into that setting.
We have time for 3 more questions. Operator, could you put through the next one, please?
Next is Matt Woodman with CTV Edmonton. Go ahead, Matt.
Hi, Dr. Hinshaw. We heard from a parent today who said she sent her kid to class and she felt her child wasn't given enough of a break from the mask. She said the only time during the day her child got to take her mask off was during the lunch hour. She even had to run with it for quite a few kilometers during gym class. I'm just wondering if there's anywhere that mandates how long a child should get a break from their mask while attending school, or if there's a recommendation you have in terms of how long a kid should get a break from a mask.
That's a really good question. In our provincial policy, as you know, we left opportunities for children to have a break. And one of the exemptions that we did put out was when children are engaged in physical exercise, that mask wearing would not be required during that time, although distancing would need to be maintained in those settings. And so I know we've had this question a few times lately about what is that definitive cutoff, and I don't know that we have a time frame exactly, but I guess I would say that the framework that we put forward does try to balance those needs, and I know that school boards have gone forward with their own frameworks based on their own epidemiology and their own assessment of risk. So I think in this case, it would be best for parents to bring their concerns to the school board if they are concerned about the length of time that their children are wearing masks. And I know it's something, again, that we are looking to see if there's evidence around a particular time frame, but at this moment, I don't think there is that strict cutoff that I would be able to say what should not be exceeded.
Operator, can you put through our next caller, please?
Next is Nicole Stilger with Global News Edmonton. Go ahead, Nicole.
Hi, Dr. Hinshaw. Thank you so much for taking my question. As you likely know, of course, Saturday will be 6 months since the first case of COVID was recorded in Alberta, and we've often heard this term pandemic fatigue, and I'm wondering if you've noticed a shift in tone from the public, particularly directed towards you, and especially this week with the Order 33 clarification and back-to-school stress, and how you feel about that.
Pandemic fatigue is a very real thing. COVID-19 has taken many things away from us, and I know that I would love to be able to return to the old normal, as I'm sure many Albertans, probably all Albertans, would love to be able to do. So, I think it's quite normal for people to feel tired, especially with back to school and heightened worries about what will happen. This is a new situation, and so as we're moving into that time, I think it exacerbates some of that frustration, some of the fear, some of the feeling of perhaps, again, frustration that this is something that we can't see the end of. I've been asked that quite a few times. Well, what's the end? What do we have to look forward to? And so it's totally natural that people are feeling frustrated. And I can understand why, especially because of the way that Order 33 was released, why that would have become a focal point for some of those frustrations. So, I guess what I would say to people who are feeling tired of the pandemic, tired of hearing me talk every day, tired of hearing about COVID-19, just want it all to go away, I would say I sympathize. I too wish that it would just go away. And so I think the best thing that we can do when we're feeling like we're kind of at the end of our rope is to figure out what helps us recharge, what helps us get re-energized. And there are many things that we can do within our COVID frameworks, and try to take a break from COVID-19 for a while. Try to unplug, relax, and just give yourself a break from the constant stream. Because unfortunately, the reality is that we do need to pace ourselves because we do need to be looking for a time when we either have an effective and safe vaccine or an effective treatment that can reduce the risk of severe outcomes for those who get very ill. And until that time happens, we continue to be each other's best protection. So again, the reality is not what any of us would choose if we had a choice. But what we can do is support each other through the fatigue, through the frustration, and pick up and carry on another day after we take a bit of a break and recharge.
All right, thank you. Operator, could you put through the final question, please?
Final question is Mirna Juchik with Radio Canada. Go ahead, Mirna.
Hello, thanks for taking my question. Just a clarification about the new guidelines for long-term care. Is there any change to visitation guidelines at this time? And if not, do you see any potential for changes in the future weeks?
At this time, there is no change. The visitor restrictions in continuing care, that visitor framework, is a part of a separate order and guidance document that was updated in July. And at this point in time, we have heard mostly quite encouraging feedback from residents, families, and operators about the enhanced ability to visit while still maintaining the safety that we need to provide to these residents who are at the highest risk of severe outcomes. We will continue to assess, as we always do, the need for any further changes, but this particular framework is really focused on other aspects of how continuing care facilities operate. And one of the concerns that we've had quite frequently in the last month has really been about that mandatory quarantine for all times that residents are off-site for more than overnight. And so we're hoping that this new framework will address some of those concerns. But again, we always continue to monitor, evaluate, and see if there's any further adjustments we need to make going forward.
Thank you all for joining us today. Dr. Hinshaw will provide another update on COVID-19 tomorrow. Have a good day.